Jamie Daigle is a stay-at-home mom who loves being with her son Seth. They enjoy the outdoors, taking walks and spending time with friends. But there is always a sense of concern because Seth doesn't have health insurance.
Seth is uninsured because I am not working and my husband is working for a small company which doesn't offer health insurance.
Jamie and her son were fully insured when she gave birth to him 17 months ago. But they lost her coverage when she decided to stay home with her baby.
My husband has a great job at a small aviation business. He's a full-time mechanic, but unfortunately it is a very small company with about 20 employees, so they don't offer health coverage because it's too expensive.
Being a small business owner of a small business with less than 25 employees, it's virtually impossible for us to acquire health insurance because the way the market is right now, the insurance companies either don't want to insure us or they charge way too much for the employer and the employee.
The healthcare system in the United States is primarily employer-based, but families, young families with young children often work for very small employers who have less than 50 people in their company. And for that group of employers, health insurance is incredibly expensive.
Chad, Jamie's husband, enjoys his career as an airplane mechanic and loves the company he works for, but he worries that he may have to leave if he and his family don't find coverage soon. There are over 9 million children in this country who are uninsured, but there's good news. 4 million are eligible for federally assisted programs such as Medicaid or the State Children's Health Insurance Program, also known as SHIP.
The main reason families have to turn to Medicaid and SHIP is that they've lost their jobs and don't have coverage for their children, or they are young families working for small employers that do not offer health insurance.
The Daigles have recently applied for both state-assisted programs and are waiting to hear if they qualify. Tammy DeLuca is at ease, knowing that Medicaid is there for her family. Recently, she gave birth to a baby boy who was 14 weeks premature.
David is doing quite well. You know, he's now over a month old, and he's almost doubled his birth weight.
He weighed 1 pound 14 ounces when he was born and will have to remain in the NICU until he reaches full term.
We wouldn't have been able to afford what is happening right now without Medicaid.
The company for which Tammy's husband works does offer a health plan, but with 5 kids to support.
We didn't have a choice. I didn't feel like health care insurance that was offered by my husband's job was far too expensive for us to afford, and we didn't have a choice.
SHIP and Medicaid is really quite a good deal for the American people. It is an investment in our future. It is giving health care to children to keep them healthy so they learn better and become more productive adults.
Unfortunately, there are many Americans who qualify for state-assisted insurance programs who have not yet taken advantage of these plans, and so their children remain uninsured.
Being uninsured is a terrible situation for a family to be in. They often don't have timely access to medical care. They get their care in emergency rooms, so it's episodic. There's very poor follow-up. It's very costly to them and to society.
Good health care coverage does the obvious. It keeps children healthy. But it can also help children become better students and ultimately happier, more productive adults. It's truly an investment in their future and one every child deserves.